We provide the answers and a better understanding of the world around you. Therapy Came Alive.
We have a special report today. We're going to be talking to Dr. Michael Strober about eating disorders. Who's Dr. Michael Strober? Well, he's a Resnick Professor of Eating Disorders and Psychiatry at UCLA's David Geffen School of Medicine. Let's welcome Dr. Strober to the show. Welcome, Dr. Strober.
Thank you.
So this seems to be a very powerful disorder. What I mean by that, it seems it's hard to overcome. But before I get into that, what got you involved in looking into eating disorders?
Well, the simple answer is pure curiosity. I came to UCLA in 1974, joined the faculty in 1975. I was posted on the adolescent inpatient service as the attending psychologist. The service had already established a long tradition in the treatment of eating disorders, anorexia nervosa specifically. I quickly became curious about what I saw, along with my early interests in youth depression and bipolar illness.
Interesting. And let's move to the present now. What kind of things did you find in your latest research about eating disorders? Anything that really stood out to you lately?
Well, what quickly stood out and which I became intrigued by was how similar young people with anorexia nervosa were in terms of their background behavioral characteristics.
Oh, interesting.
Sensitive, sometimes shy, nervous and anxious, a tendency to worry, very disciplined, very goal-oriented, very sensitive to their surroundings. And it was remarkable how similar each person was in regard or in reference to these background characteristics. It was almost universal, suggesting to me that the characteristics were in some way related to how this illness evolved over time, that there was something afoot, something operating beneath the surface in behavior and development, presumably even the biology of the brain, that was relevant to eventually the emergence of symptoms, which for most individuals is between the ages of about 12 and 16.
Wow, that is fascinating. So there's actually a strong correlation with that.
Yes, in the research, I became curious about the familial nature of anorexia nervosa, given that I always had an interest in the genetics of behavior and the genetics of mental disorder. So back in the early 80s, I was intrigued by the question, are eating disorders familial? Do they run in families? And do other mental disorders run in families? And that began what remains a current area of research for me and colleagues that I have around the world.
I know we did receive a question. Somebody wanted to know, and it's kind of along the same lines of what you're discussing right now. Is there a correlation between over-strict parents?
No, there's not. That's an old adage, an old sort of, it was an old clinical wisdom that has not been substantiated. There's no evidence that over-strict parents has anything to do causally, etiologically, with anorexia nervosa.
Oh, that's good. I like to always have latest research. Let me ask you this now. You mentioned some of these characteristics that they have, goal-driven. I think you mentioned perfectionist, if I'm correct.
Yes.
Are these? Do you know if it's in the time? Where in the timeline do they fall? Is it before their anorexia disorder develops? Is it after? Is it a manifestation?
It's before, and sometimes the characteristics are accentuated once the weight loss emerges, but these are traits that appear in development prior to the beginning of weight and shape concerns and weight loss.
Interesting. And do we have any kind of early ages that they begin? Do they begin at 10 or 11 years old or anything?
Frequently, parents will describe the onset of these characteristics relatively early. And by relatively early, we usually mean prior to age 8. So So it is not unusual for parents to describe their child in terms that I mentioned, even beginning quite early in development.
And what similarities or what correlations did you find in regards to the familial aspect?
Well, we first reported this back in the 80s. More recently, in a paper that was published in 2000, showing that the occurrence in relatives of eating disorders, the occurrence in the relatives of people with either anorexia nervosa or binge eating, bulimia nervosa, which is a certain type of binge eating disorder, was significantly greater than the occurrence in the relatives of a control population that we had. The control population, people who did not have eating disorders. And that is what is meant by familial, when relatives of people with a disorder have the disorder at a greater rate than you would expect in the general population. So we did see that quite prominently in the relatives of people with anorexia nervosa and the relatives of people with bulimia nervosa. The odd thing was, or at least what we did not expect, was that both disorders, what we call cross-transmission, meaning that bulimia nervosa occurred more often in the relatives of people with anorexia nervosa than in the relatives of our control people. And the converse was true, that anorexia nervosa was more common in the relatives of people with bulimia nervosa than in the relatives of our controls. So each disorder is transmitted in the families of opposite diagnoses. Anorexia nervosa is increased in families of people with bulimia nervosa, and the converse is true.
Interesting. That's really fascinating. Any reasons behind that, you think? Or?
Well, we don't. I think the fair answer is we don't really know, but there are features, psychological traits that overlap in people with anorexia nervosa and bulimia nervosa. So it may be that the genes associated with these traits lead to this, what I refer to as the cross-transmission of the disorders.
Interesting. We know we got about 8 or 9 minutes left, and I have a couple of questions I wanted to ask you. Any correlations in regards to abuse, sexual abuse, physical abuse, anything like that?
Not. The answer to that question is that if you look at the occurrence of trauma, physical or sexual trauma, there's a higher occurrence in people with bulimia nervosa than in anorexia nervosa.
Yeah.
But in the studies that have been done of bulimia nervosa, that rate or that prevalence is probably equal to the prevalence you see in other psychiatric conditions. So it's not specific to eating disorders. My impression is that the occurrence in anorexia nervosa is not greater than in the general population.
Interesting. How about geography? Is there anything there at all? What I mean by this question is, do you see more of a prevalence in cities like LA or New York City compared to maybe more rural towns? Did you find anything on that?
I think the fair answer to that question is we don't know. But anorexia nervosa exists in rural towns. It exists in small cities. So the idea of this being of clustering in large metropolitan areas where you might think there's a greater emphasis on appearance or thinness, I think is probably overstated. We see, certainly at UCLA, many people coming for treatment of eating disorders that live in very small towns. It's well known that anorexia nervosa and bulimia nervosa occur in Europe and Japan, Australia, New Zealand, to a degree equal to what you see in the United States.
Oh, wow, equal to. That's amazing. So actually, you lead me right into my next question, which is ethnicity or race. Anything there at all? Any correlations?
It is believed to be a higher occurrence in whites. However, eating disorders occur in Hispanic youth and in black youth as well. The rates of the major diagnostic conditions are probably lower, but you can't exclude. Essentially, the disorder does not exclude individuals who are racial or ethnic minorities.
And what are the major causes? I don't know. In psychology, it's hard to say causes, but what are some of the things that you've seen that can develop into eating disorders? Is it trying to have a coping mechanism? Is it what do they do? Why are they doing it?
Well, I think the story there is very complicated, but again, the roots for anorexia nervosa, the roots are clearly in this constellation of anxiety and sort of strong habit traits, compulsivity of behavior, regimentation, the need for sort of predictability and sameness, which you begin to see in early development, which suggests that there are predisposing factors once weight loss sets in. And by the way, the weight loss that develops in a condition like anorexia nervosa is not weight loss with the intention of losing 50% of a person's natural body weight. Once weight loss begins, it becomes compulsive. At least the drive to lose more weight becomes compulsive. And the illness certainly reflects biological processes that we don't fully understand. But also, for the individual, it takes on a certain meaning, a certain purpose, some of which the individual is not consciously aware of. Some people think that that's a controversial position. However, when you talk to people with anorexia nervosa, they will describe a strong feeling of discipline, uniqueness, and accomplishment, which means something to people who, by and large, have marked insecurities and self-doubts, in spite of their many admirable qualities and characteristics. Some people are extraordinarily skilled, very bright, but there is an undercurrent of feelings of doubt, insecurity, averageness, mediocrity that sort of runs through the history of very many people with anorexia nervosa. So there's an illusion of discipline and strength and accomplishment, which may, for these people, sort of take the place or overshadow the insecurities they have. But biology is operating as well in ways that we don't fully understand.
That's a really good point. A couple minutes left, I know that. I want to definitely get to your book because I know you give us a little insight on how to overcome it, or at least how to fight this battle. Before I do that, last question is anything with body dysmorphia?
Well, it's interesting you ask because my colleague at UCLA, Dr. Jamie Fusner, who is an authority on body dysmorphic disorder, and I are studying at the moment similarities, or at least we're searching for possible similarities in how information is processed visually. The brain has a system for processing information, and there's at least some preliminary evidence using what's called functional magnetic resonance imaging, MRI, or fMRI, that suggests there are commonalities in how the brain processes even emotionally neutral information in body dysmorphic disorder and anorexia nervosa, which may be a factor underlying the peculiar body image problems that you see in people with extreme weight loss.
So this might be a TBD, to be determined.
It is likely to be a TBD, yes.
And tell us a little bit quickly about your book, Just a Little Too Thin, How to Pull Your Child Back from the Brink of an Eating Disorder.
It was written, I don't actually remember when it came out, but it was more than several years ago, and the focus was on how to help parents manage the challenge of weight loss, which then, or at least an excessive preoccupation with weight, shape, and eating. Essentially, the goal was to help parents sort of nip this in the bud, so to speak, by interventions that would hopefully be more preventative.
That's a great idea. Great book. Everybody, Just a Little Too Thin by Dr. Michael Strober. Dr. Strober, thank you so much for being here.
Well, thank you for having me. I appreciate it.
And where can we get more information about you and your work?
You can reach me via the UCLA Eating Disorders Program.
Excellent.
Just
Thank you.
Google and you will find me.
Dr. Michael Strober, Strober. Thanks again, Dr. Strober. I hope you enjoyed this report on eating disorders.